Commissioner, I think we can begin.
Excellent. Thank you so much for being here and for joining us tonight to talk through some of the changes in current landscape for the EEC field and stakeholders. I wanted to start by just acknowledging that the landscape has changed significantly. Since our last update in the fall, the last commissioner's update in the fall, we have seen new variants and this COVID surge, and we do know that it is scary, and I know things are changing quickly, and at times it feels to all of us like it's March 2020 all over again, making rapid decisions with little information. But I want to assure you it's not 2020 over again. You have now operated childcare and served families and been responsive to children's needs in the midst of really insurmountable COVID measures for over a year and a half now. You have built new knowledge, the routines, the expertise to manage day to day in your operations and amidst the COVID environment. I can see that it is taxing, and it's taxing on all of us. I see you rising to the challenge when the system is already exhausted. I see the strained workforce with staff openings and shortages in almost every corner of our sector. Programs continue to pivot and adapt and respond, and families are trying to navigate their own changing health guidelines and their own difficult choices based on what their own needs are between work and health and their children. And I want to assure you that we are going to continue to do the best we can to be responsive and to support you in our role. As the licensing entity for childcare and out of school time programs, as the state agency charged with stabilizing operations to serve children and families and make sure that we can be responsive to their needs. And in that role, we will continue to do our best to equip you with the resources, the guidance, the protective factors that you need that can be appropriate to the changes that we've already seen. As I highlighted at the last EEC board meeting, we have spent a year and a half together, almost 2 years now, navigating together, working together to learn about what the new needs are and to help EEC build systems that will respond and support you in being able to be responsive to children and families. I wanted to take a second and talk a little bit about how we have really invested in the COVID mitigation resources from EEC and help you understand where you can access these resources and what might be available. I want to share some of the ongoing expanded supports and some of the things we're going to continue, so to make sure that you can rely on these resources as you know the landscape changes right from under us. We are continuing to invest in free PPE, ongoing monthly orders that you can do right from your LEAD portal, with delivery right to your doorstep of every licensed childcare provider. Based on the responses we heard of some of the challenges we've seen collecting for our programs to receive KN95 masks, in February, we begin to include KN95 masks in our PPE orders so our childcare programs can access the limited supply. In addition, we have updated our COVID recommended protocols and guidelines. While certainly these are applicable to childcare, we hope that all of our stakeholders will use these to help understand when and how children and families might be able to continue in care and given the changing landscape. These were developed collaboratively between EEC and the Department of Public Health. making sure that we holistically are taking into account the operations of childcare and the needs of children, families, and our workforce in the face of the COVID crisis. We've been working continuously with DESE to make sure that our programs have aligned guidance with their K-12 district counterparts, making sure that we can keep everyone as cohesive as possible and allow children and families to have as much of a seamless experience as they can between the schools and the out of school time providers they rely on. We've created recommendations and support, but we know that this decision-making must happen at the local level, at your program level, that your illness policies that you create for your childcare business dictate who and when children can be excluded from care due to symptoms, whether they're COVID-19 related or not. And how you actually need to set parameters for your business that help make sure you're responsive to the community landscape. We hope that you'll use these protocols, these recommendations, as you review and update your own policies, your own illness policies as they relate to COVID, as well as your exclusion policies from childcare of when a child must be excluded from care to protect the group. I want to reiterate that while we at EEC are here to support you with all of your regulatory questions about childcare and support with your program opening, making sure that you can maintain your program's operations, whether that's childcare, coordinated family and community engagement providers, or other types of operations that families are relying on and services that families are relying on. But our staff here at EEC are not public health experts, and they cannot offer guidance in lieu of the consultation with your local board of health or your public health professional that you're working with. While we are working to expand resources that all of our childcare and our stakeholders can rely on to be able to navigate the public health questions, we at EEC are experts in regulations, we are experts in child development, but not necessarily in the public health and infectious disease. And we hope that you will rely on those experts to make these really critical decisions that you're faced with on a daily basis. I want to also provide a couple important reminders. First, programs are required to report COVID-related issues that impact their program operations. For childcare operations, for example, that may mean an exposure positive case that leads to a temporary classroom closure or adjustments to your operating schedule, or perhaps a whole site or a family childcare closing temporarily to make sure that that exposure does not lead to a positive case. These are reports that are filed through your lead incident report for childcare providers. This is a requirement that has been in place from the beginning of the pandemic, but certainly is relevant to all operations and all infectious diseases when it impacts your operations. I want to highlight that our childcare programs are not required anymore to report to COVID cases through the separate additional Department of Public Health reporting form. We were able to work out with the Department of Public Health to gather this information from alternative sources so that we could relieve the burden on childcare providers of having to report every positive case that impacts their children, families, or potential exposures that may be to family household members. We know that particularly when their case transmission is so high, that we know that families may have multiple cases, and we don't want to overburden our providers to make sure that we can't that you can't do the work you need to do every day. So right now, please just remember to report to EEC through the LEAD portal when there's program operations that are impacted by COVID at your site. I also want to highlight some of the free COVID testing for childcare. One thing I do have to note is that while we do want all of our childcare, all of our ages to be served and be able to benefit from the testing, there are some FDA rules and authorities that we need to take into account as we have been rolling out our testing. Unfortunately, right now, the FDA has only approved rapid antigen tests for children 2 and older. And the PCR tests that we use in pool testing are only approved for children 3 and older. So we just want you to know, as we talk about these, we'll be closely following the FDA approval, and any time that there is expanded approval of our tests, we will make sure that we provide guidance and support on how testing can be used in the new age groups. First, I know that many of our providers rely on our our PCR sites across the state. And we continue to support the mobile PCR sites that are drive-through rapid response testing sites that are available across the state. These are dedicated solely to EEC staff and families that are working with our programs. And this week, you will start to see extended daily hours, weekend hours, more drive-through lanes, and other adjustments since we've seen the expanded demand over the last few weeks. Much like every part, know that we are working to expand and respond to the demand, but like everyone is experiencing, there are workforce shortages that limit our capacity to be able to perform testing at these sites as well. And we're working with our vendor as quickly as possible to address these and make sure we have expanded resources. I also want to assure you, with the announcement today that we'll talk about in a second, that the pooled testing initiative that we have had going for about a year now in childcare, the first in the country pooled testing, surveillance testing for childcare, continues to support no-cost weekly surveillance testing, PCR testing in childcare programs, both family childcare and center-based programs in partnership with neighborhood villages. Today, the Baker-Polito administration also announced that we'll be using the recently secured 26 million rapid antigen test to help support the launch of rapid antigen testing at childcare providers to make sure our children can stay in care and our workforce can remain safe when there is a direct exposure. Testing for childcare, the testing for childcare options that we announced today provides all EEC licensed and approved programs with access to free COVID-19 testing, resources, training, protocols, sample forms, all the things that we know our programs need to implement testing strategies and specifically designed to help support childcare to keep children and the workforce in care. This expands our partnership with neighborhood villages based on their successful track record, helping us administer the pooled testing and the rapid test distribution that we were able to do early in this year. It is so important for our children to have to be able to remain in care, to be able to rely on the routine and stability of our expert educators out there working to ensure that children continue to learn and grow and play and through all of the tumultuous landscape. We know that it is vital for your staff to feel confident, and yourselves and your household members to feel confident in that the childcare that we're providing is safe, and that they can assure that they have the resources that if there is a potential exposure, that we are addressing those immediately and preventing any additional transmission. We encourage you to take advantage of these testing resources and all the strategies that you're able to employ by enrolling with neighborhood villages. So you know, all enrollment, antigen tests, the pooled PCR testing, and all other resources offered by neighborhood villages are all free benefits to the childcare sector and available to all of you who serve families. I hope that the addition of these resources allows programs to provide continuous services, even as we endure the rapidly changing COVID landscapes ahead. Childcare programs will start receiving these rapid antigen tests by the end of January. So please enroll as soon as possible to make sure that you take advantage of these resources as soon as distribution begins. I want to make sure you know that those of you who are able to enroll by January 24th will be part of that distribution for January 31st. And then enrollment will be allowed on an ongoing basis. So if you miss that deadline, don't worry, just enroll and we'll make sure that you receive a delivery in the upcoming week. I do want to share a few more specifics about those testing strategies and ensure that you know that Neighborhood Villages is here to help. We know that there's so much to implement, and we've watched as DESE has navigated testing distribution with schools and making sure that we have those resources available to you as childcare providers is a vital game changer to make sure that we can support your operations to stay stable and continue providing care that families are relying on. The new program that we are rolling out with the antigen testing is the rapid cohort testing. This is rapid antigen testing for when a classroom or a family childcare cohort has an individual that has been tested positive for COVID-19, and there is a known direct exposure from the rest of the cohort that have been potentially exposed to COVID-19. The COVID-19 positive individual. The goal of this approach is to replace the need for programs to exclude the entire classroom and the workforce from care. A cohort might be a classroom, it might be a group with household members in a family childcare home, or it might be a partial classroom if a program has decided to group children together to help mitigate the risk within the program day. The most appropriate use of this strategy is when an individual within that cohort is confirmed positive for COVID-19. And you can use, the rest of the cohort may use daily rapid antigen testing for 5 consecutive days to ensure that they continue to remain negative as they progress through, as they attend care. This means that the rest of the children and staff get to remain in care and continue to work safely, knowing that everyone they are with has tested negative and the protocols for safety have been followed. We also encourage programs to use these rapid antigen tests for symptomatic rapid testing. This should definitely be aligned with the program's illness policies, making sure that any time that a child or staff is exhibiting symptoms of any kind, that you're carefully checking to make sure that you are following your own illness policies of when someone needs to be excluded from the site. However, we also know that in many cases, there is fear of whether this person needs to just be excluded or isolated because they're COVID-19 positive. The goal of this approach is for programs to be able to identify when symptoms are related to COVID-19 and when they are not. The most appropriate use of this strategy is for an individual that has the onset of symptoms while they're either attending care or show up at care. We want to make sure, again, that you're following your program's illness policies, but you're able to confirm whether the onset of symptoms is related to COVID-19 or not. There are a few requirements to note for all of these programs for those of you who wish to enroll with the free testing supports. Programs will be expected to follow EEC's EEC's COVID-19 mitigation protocols and guidelines for childcare, including the mask policy for the appropriate age group. This is because the most effective implementation of testing programs, like the one we are developing in Massachusetts, the first of its kind in the country for childcare, is in the context of comprehensive COVID mitigation strategies, making sure that you're not just relying on testing, but doing all of the effort, making all of the efforts necessary to prevent COVID-19 transmission at your site. We want to make sure, of course, that all of those who are tested provide consent. And if you enroll with Neighborhood Villages, we encourage you, they will provide consent forms so you can sign up and make that easy for your families and staff when it comes to testing. In addition, there will be trainings and a portal to make sure we're tracking, to make sure you're tracking family consent and testing provided by Neighborhood Villages. I want to assure you that you do not have to enroll in Neighborhood Villages if you are purchasing your own tests or have decided to purchase a bulk test for with a cohort of some kind, a consortium of some kind. But we still encourage you to take advantage of their trainings, the resources, the forms, and the protocols to make sure that you are able to implement a testing strategy with fidelity. It is really our hope that between the free PPE and the free testing options, the guidelines, the protocols, and all of the resources that EEC is aiming to share, that our programs and our educators and our families feel equipped to navigate the COVID-19 pandemic throughout this winter and into the future. We know that we'll be living with COVID-19 and as we settle into to operations for the year. And we want to make sure you have the resources to be able to continue serving families, that families have the continued resources to feel safe in your care, and that we are working through this as we navigate the tumultuous landscape. In addition, I wanted to talk about one other resource that we're offering to childcare as well. As many of you know, we have been providing the C3 operational grants to childcare since July to help stabilize the fluctuations in enrollment that many of our programs have seen. We know that operational costs for childcare have remained in place and even grown as you've worked to mitigate COVID-19 in your sites. But we also know that that childcare providers rely on the revenue from family fees or subsidized tuition to be able to afford those operational expenses. With fluctuations in enrollment due to the health landscape, we know that licensed childcare providers needed some support to be able to remain open while navigating this very tumultuous time. We also know that those of you who serve families in other capacities rely on childcare to be able to make sure your families have the resources they need to go to work, to be able to support their children, to make sure they have the wonderful learning experiences we all rely on to make sure children are learning from the start. So we have been providing these monthly grants since July to help address the operational costs of childcare businesses, knowing that those families who relied on them were also having their own difficult time. The grants are distributed through the Commonwealth Cares for Children formula, which takes into account licensed capacity, as well as the number of educators a program has in place, which accounts for their operational costs, and adjust for equity to reflect both the community and the population that is served by the program. We have had incredible engagement from providers. Over 80% of our licensed programs have been participating. And by the end of this month, EEC will have distributed over $200 million to programs to be able to support their operations through this year. Thank you for those of you who participated in the grant survey we issued in November. For the first time, we have a better understanding of how these funds are being used and how critical they are to your operating budgets in childcare. We also have a better sense of some of the enrollment and workforce challenges you're facing that help us make the case of why these grants are having an impact on your sites. This also allows us to shape strategies and support educator recruitment and retention, and even to continue supporting you and your colleagues in the communities even better. I know many of you have been curious about the highlights from the survey. So I'll point you to the board meeting from earlier this month to get a little bit more depth of numbers and graphs and resources that are available in the materials from that board meeting. But let me just hit a few highlights. 94% of programs say that they need these grant funds just to support expenses in the next 3 months if they're going to sustain operations. Whether you're a childcare provider yourself, or whether you work with families and children who rely on the services of childcare, we know that this is vital to make sure that these resources still are available. We also know that many programs are still not operating at full license capacity due to staffing shortages and family choices to keep their children out of care for various reasons. Almost 70% of our centers who responded say that they report educator openings that they need to fill. Over half of the childcare centers using grant funds for their current educator compensation, but over 25% say they plan to use these funds for salary increases moving forward. I want to highlight that when we've looked at these funds, at the enrollment, we know that we are for the first time understanding who is using our childcare programs beyond those who are accepting EEC subsidized childcare tuition. And we know that 2/3 of families that you reported come from families with incomes below the state median income average for a family of 4. So the ability to continue paying for childcare is certainly a challenge when we look at the landscape ahead as well. Although 62% of our programs have looked at tuition adjustments either in the past year or in the future year, many of you who are serving lower income families have committed to not raising tuition rates either last year or the year ahead, which means obviously a huge challenge in your operational revenue. As we look ahead, we know that childcare is a pillar of the community that we have to continue to support. And we were thrilled in December to confirm that these grants will be extended through the end of this fiscal year, June 30th. We also know that we are able to now invite programs to participate, even if they were licensed or funded after March 11th. So for those of you who haven't had access, please do go and apply. You are now able to be able to access the grants. We've also been looking and reporting to the board on plans for adding a bonus structure to the grants that would recognize the efforts that you are doing to recruit and retain highly qualified workforce. We want to take into account the investments you've made in things like salaries and bonuses and improved benefits, as well as the other professionalization and supports you provided to your workforce. For family childcare, we want to make sure that we recognize the ways that you've been responding to families' needs, longer hours, bringing in additional resources, making yourselves available in critical ways that families have relied on, but are taxing and take more of your hours and cost you more to be able to provide. Considering things like bonuses and structures, hours and schedules of care to families are all things that we know enhance access for families, enhance the program quality, but also can be a challenge amidst so many revenue challenges. we're still working to determine an appropriate bonus structure, knowing that the workforce, the family supports that you offer are really unique to every center, every home-based program, and really need to be tailored to the educators that you work with, the communities you serve, and the families who are relying on you. We're working to establish a simple, fair, and transparent bonus structure that also is flexible for programs to continue making the best decisions for their workforce and their communities. At our board meeting on January 11th, we shared an initial analysis from the C3 operational grants from the webinar we had in December. Early results of grant survey of how you think we should prioritize the bonus structure. The feedback you continue to share in these sessions is an active part of the process to shape our thinking and determine our approach. And you can still give us your feedback. The operational grant survey are still on the engagement portal and are available in 4 languages. So please do take advantage of those to help us inform the ways you think we should be prioritizing the bonus structure for the C3 grants. We also will host another live session on February 1st to pressure test some of the ideas we are coming up with and give you a little bit more detail to respond to as the ideas are emerging. Please register for this on the engagement portal. And there's so much more on the engagement portal. So continue to check it out. We do keep putting out webinars as we're all learning together. We want to make sure we have your input as we're making decisions that will impact you, your sites, your communities, your families, your grants, all along the way. I want to take a few minutes to give a few additional reminders. First of all, I wanted to remind everyone that our educator policies were launched, our revised educator policies were launched the first week of December. As you'll remember, the board did afford us the opportunity to forego some of our regulation requirements for educator qualifications. And instead able to put forth policies that would provide more flexibility for our programs who are struggling to recruit workforce to meet the needs of families. Thank you so much for all of your feedback. You responded, we responded to much of it and immediately republished some clarifications and modifications to make sure that we were opening up options and not limiting any options to educators who were already working towards a credential or lead teacher. The ultimate goal is to make sure that our center-based early childcare directors can be in charge of retaining and recruiting educators more quickly, empowering our sites to be able to make decisions about educators who demonstrated the competency necessary to work with children without being so restrictive on the ways that they have gotten that over the years. Similarly, for family childcare, we want to make sure that we're streamlining the assistant processes to reduce the administrative burden and make it easier for family childcare to recruit assistants and help them serve more families and more children and really provide the responsive education, the responsive care that we know our family childcare strive to deliver. We are thrilled to report that in the first weeks of implementation, we've supported over 600 participants in our office hours, providing direct technical assistance and helping to understand the flexibility, navigate your own decisions, and help evaluate some of the criteria that your workforce is coming in with to make sure that it really does reflect the competency you want to see your children, the children being served with. We also are in the process of launching the online registry, which will be a tool for educators in both supporting, having a one-stop shop for all of the things they need to be qualified to work in the childcare setting. It will certainly be a strong tool for our program leaders, both family childcare and site-based leaders, to make sure that they have the flexibility in implementing these educator policies and protocols with a streamlined process that will allow for an online filing cabinet of all the required documents that an educator needs to have. We look forward to launching that in the coming months. Given the surge, we have opted to delay the launch a little bit so that we could have people focus on operating, and we'll update you on timeline as soon as we have more information. The technology is all ready. We've been vetting and doing user acceptance testing with key partners in the field, but want to make sure we're not throwing too much at everyone when we know that the operations, that change will take some getting accustomed to. And right now the focus needs to keep being on making sure our sites and our communities are safe. Finally, I do want to highlight about our parent fees. For our subsidized tuition, those enrolled in our subsidized childcare tuition, we wanted to highlight that last year, the EEC board approved one of the most innovative parent fee approaches in the country. This is the parent copay required from the federal government to accompany our subsidized tuition, our childcare tuition subsidies offered to low-income families. For families whose childcare is subsidized, the parent copay operates on a scale depending on the family income. In the new approach, families will not pay any parent fee if their income is below 100% of the federal poverty level, and will only pay fees on the incremental income above that level. I wanted to highlight that under this new model, parents will begin paying fees on February 1st, and subsidy administrators have gotten the information, have participated in trainings and orientation, and are encouraged to continue reaching out if there's help or support that people need. Across all of these initiatives, I want to encourage you to visit the EEC strategicplanportal.org to stay in touch with us, understand what's going on, have opportunities to provide feedback and weigh in on some of our initiatives, see progress on the initiatives that you're hearing about here, and much more. Despite the fact that we know that there will be a tumultuous year ahead and that we will be living with COVID for the foreseeable future, we want to make sure that we continue to provide opportunities for you to give impact, for you to be able to provide the feedback on what's working and what we need to continue to improve. At last month's board meeting, we had an opportunity to reflect on the almost 2 years of COVID and all we have accomplished together. Everything from starting the emergency childcare program, supporting family packets through our CFCE providers and our regional offices to help families who are now home with their children, to reopening childcare and creating protocols based on ever emerging information from the health community. All of this has been done in partnership, and we are committed at EEC to continue to listen and hear and respond and build the systems as we know we need to do to be responsive to you all and continue supporting your operations. So I know we have a few questions before we close up. I'd love to answer some of the questions.
Thank you, Commissioner. We do have just a little bit of time left, and we collected questions at registration. And so we will actually respond to the questions that we had submitted in advance first. We do understand a lot of questions have also come in over the course of this evening, and we will direct to the appropriate resources accordingly. So, Commissioner, one of the questions submitted is about PPE and rapid tests questions about how small centers can afford things like the KN95 masks, for example, et cetera, some of which I think you've addressed, but perhaps just to reiterate.
This is a great question and is exactly why EEC has built systems to invest in the free resources for programs throughout this pandemic. Since programs began reopening in summer 2020, EEC has been distributing free PPE on a regular basis. EEC has invested almost $60 million to date to pay for these supplies and is committed to continuing these important resources. As I mentioned earlier, things like KN95 masks will be added to the PPE resources starting in February. And today, of course, we announced the new testing for childcare strategies that will really and truly offer invaluable resources to keep operations open on limited budgets. Free rapid antigen tests for all programs that enroll. We really hope you'll take advantage of these. As I mentioned, we know that a budget and operations are tight, and for our small programs struggling to continue to be able to serve the families who rely on you, these vital resources are our ability to be able to support you in this tumultuous time. I also want to highlight that these are new systems and we're responding as quickly as we possibly can. And so thank you for your patience and your feedback and helping us understand how we can be responsive to the needs we know that you have and learn every day about the new needs you have and how we can use our state resources to support your critical infrastructure.
Thank you, Commissioner. I think looking ahead, there are a number of questions related to the very specifics within childcare programs around quarantines, different factors around exposures and vaccination and close contacts and how that's defined, et cetera. A lot of very specific questions. Do you have a recommendation for people who have questions like those?
Please take a look at our revisions to the COVID-19 mitigation protocols and guidelines for childcare. We built this resource and then revised it and re-released it today based on the feedback we received to you to make sure you have clear, accessible source of information and the guidance you need as leaders and educators to navigate the very specific nuanced decision-making based on the circumstances of not only your individual program, but the child and family that you have in front of you. I will say throughout this pandemic, what we know is that this guidance, while the guidance is written in a way that you can apply to your local setting, there are nuances to every situation that you have to navigate, and there's no universal answer. So this is why we want to make sure that we have provided you the guidance, we have provided you the resources, but all to be able to help navigate these decisions on your own as much as possible. And we'll continue to build the resource of a public health line that will be available to help make sure that you all, as you encounter these nuances and look to apply this guidance to this specific situation you have in front of you, that there's someone to reach out to and help to understand the public health landscape as well.
Thank you, Commissioner. I think since some of the announcements around rapid testing, there have been questions, a lot of very specific questions sometimes, but things related to who can conduct the tests, comparing rapid tests with pooled tests with PCR tests, and just a lot of testing questions. Where would you recommend people with all of these specific testing questions turn for answers?
Absolutely. So I want to start with to highlight that the testing for childcare options that were released today, we encourage that programs take advantage of all three if possible. We know that pooled testing has been an invaluable resource for so many programs over the fall to make sure that they were catching COVID positive and preventing transmission. And the addition of rapid antigen tests allows you to complement the pool testing even more so with immediate answers about potential exposure. But we also know that where tests happen, how sites are set up, what staff sites have available to be able to help implement tests is very individual to the program operations, whether you're a family child care or a center-based site, what kind of staffing model you have and hours and the family capacity that you have. So we will be working with neighborhood villages to provide the technical assistance and training and resources necessary to be able to design a system specifically to the site that you're working in. That means that tests, we have the flexibility of where and who can perform tests, but also be able to have the support to make sure there's appropriate protocols if testing needs to be done on site in a special room, or have the staff available. Neighborhood villages will help make sure that you have thought partnership, that you have technical assistance, and you have the resources you need to be able to design something that works for your specific operations, for your specific site, and most importantly, for the staff and families and their comfort level of navigating the testing options. The information sessions will begin January 31st and continue every other week through March. And Neighborhood Villages also provides specific training to each testing strategy. So the office hours for programs, there are office hours for programs that have already enrolled in testing to ask about specific technical or implementation questions, and we'll continue to build those out as we see the demand from childcare grow with these additional testing resources and options. The office hours take place weekly, and we really encourage you to go and talk with Neighborhood Villages, who has garnered testing expertise from around the country to be able to help support this really critical resources in the very individualized type of operations each of you have.
Thank you, Commissioner. There were a couple of questions submitted at registration about the regulation revisions that the EEC has been conducting. Is there a status update you can share on that?
Absolutely. Many of you participated in our sessions to provide feedback and insights for the revisions to the EEC licensing regulations. And starting in January of 2021 and continued in July and November of last year. We've taken all of that feedback provided in those sessions as a vital part of our work here. And the EEC team has been working through potential approaches and drafting different revised sets of policies and regulations. We encourage you to view the recording sessions to get caught up if you haven't on the EEC strategic plan portal. But we also will be coming back out in the coming months with additional information. We first started talking about the new licensing structure with licenses by the type, licensing types by the ages of the children you serve, as well as by program setting. But you can hear more thoughts on that, and looking forward to hearing additional feedback as we learn more about what the future will hold. We will continue to hold additional sessions on those licensing regulations as soon as we have a draft to share in the coming months. And we hope that you'll attend those and help us continue to inform the key decisions ahead as we continue to work through the drafts and all of the details of licensing regulations. We know this will be a big change, and I want to continue to assure you that we will not expect programs to transition to new licensing regulations on a dime. We will have a process, and much like we are in it deeply considering each of the feedback we received in 2021. We are really looking forward to coming back, showing you how we've interpreted that, and getting continued feedback from you as we head through 2022.
Thank you, Commissioner. I think that's all we have time for tonight.
Excellent. I want to thank you all again for joining us here and for being part of this amazing community. The EEC stakeholders, the EEC and the staff here have been just a remarkable point of inspiration for me personally throughout the last 2 years. I want to reiterate what I said at the beginning. I know this is hard. It is hard on all of us. And those of you working with children and families every day are dealing with so much anxiety as we can navigate the unknown. at EEC, we continue to want to put the resources, be responsive to the needs you have, and we are dedicated to making sure that you have, that we can work to make sure that we're able to provide those kind of resources that allow you to continue serving families with continuous operations. We know there have had to been changes in your operations, whether you're a childcare provider, whether you're a school district, whether you are a service provider supporting families with young children. Everyone has had to make changes, and we know that that's hard. And we want to make sure that those are sustainable, that you are able to be responsive to the changing needs of families, and that we're here to be able to continue to show the future, to be able to continue to guide children to the future. I'm so thrilled to be able to provide the testing resources for childcare today, and looking very much forward to all of our partnership in the year ahead. Happy New Year to everyone, and looking forward to your continued feedback and partnership as we navigate this year.